Cases of COVID-19 infections around the world are on the rise, forcing countries into another lockdown as the second wave of the pandemic rages on. While Nigeria is waiting for its first shipment of COVID-19 vaccines, which will arrive anytime this month, about 1.3 people in the United Kingdom have already received the vaccine. That's 1.3 million. Now, despite assurances on efficacy of the COVID-19 vaccine, there is still anxiety as Nigeria awaits the vaccines. The federal government says it needs about 2.44 trillion naira to vaccinate 165 million Nigerians. Okay, so this is part of what we'll be talking about right now. Joining me via Skype from the United Kingdom is clinical pharmacist, UNSDG's advocate, Adaku Furibe. It's nice to have you join me, Adaku. It's nice to see you.
Hello, nice. Happy to be here this morning.
Great. All right, and we also have in the studio public health physician, Nsiabasi Ekanem. It's nice to have you, Dr. Ekanem. Welcome to the studio and to the program.
Thank you.
Great.
Thank you.
Very good. Now, let me start with you, Dr. Ekanem, in the studio. Now, because we're looking at this from the perspective of Nigeria, or maybe even Africa as it is, the issue of vaccine. A lot of people are hearing a lot of things. A lot of people are saying a lot of things. But you are in the medical circle or in the medical world. When it comes to the anxiety and the suspicion and the feeling of fear and all of that uncertainty, what are you hearing from people when it comes to this vaccine? How people are accepting it, waiting for it, or even otherwise?
Thank you very much for that question. It's one question that I have personally done some work. I've done some focus group discussions. I've done in-depth interview with key opinion leaders as far as COVID-19 vaccination is concerned. I see a very huge hurdle, and one of the things I did recommend is while we wait for the vaccine, I think this is a time where we should engage the community much more, because a lot of Nigerians have been fed with rumors, with all amount of information. If you look at, most Nigerians already have this on their WhatsApp, voice note, videos, warning them to stay away from the vaccine. Now, it's not about bringing in the vaccine, it's about who will take the vaccine. Nigerians already have demonstrated apathy for this vaccine. And I can bet you that a lot of Nigerians, a whole lot of Nigerians will not take this vaccine with the status quo. So I feel that one of the things we should be doing at this time is to engage Nigerians. Now, let us try to analyze the information that is already going viral on the social media and tell Nigerians what actually the truth is. Ensure that Nigerians receive all the information, all they need to know about the vaccine. Let me tell you, Trinity Healthcare Foundation, my own NGO, have been doing that, and we have received a lot of feedback. And that is why I can tell you for a fact that there's a whole lot of work to be done.
Okay, we'll come to this. Let's get to Adaku to give us a perspective to this. Adaku, I know you have heard a lot of things across the world too when it comes to the suspicion or the reservation around this vaccine. Why do you think people have this feeling at this time when there's a lot of desperation to get off COVID-19 and not to have COVID-19? Now the vaccine is here, but people have reservation. Why do you think this is so?
Well, it's just because of conspiracy theories. And throughout last year, we had a lot of videos, a lot of some clerics and other people against the vaccine, and this has affected the mindset of people all over the world. Even in the UK, we had people against the vaccine that had demonstrations towards the back end of last year. And even in the US, we have people that are against the vaccine, and in Nigeria as well. So it's just like a normal human problem, which you just have to solve. It's just a hard nut to crack. It's just built on years and years of misinformation. And it's just all about what you're listening to and who is influencing you and how you're being brainwashed. So we have to get on with it, and we just have to provide more public health enlightenment for all Nigerians so that they can know the evidence-based reason for having the vaccination.
All right, share with us how it is going on in the UK when it comes to government, because you said that people also have those kind of reservations in the UK.
Yes.
But share with us, how is government engaging them, or are there people still resisting that very hard? But how is UK dealing with that?
Well, at the moment, we have different vaccination centers across the local centers, and we're starting with the vulnerable patients, the elderly patients. Personally, I've not come across any patient that has opposed the vaccine. I've been involved in having consultations with patients, providing information, going through their medical history, allergy history to ensure that they are fit to have the vaccination. But what the government is doing is what everyone should do, which is to provide more public health enlightenment. There's no way you're gonna force people to have the vaccine if they don't want to, but all you have to do is to give them the reason why they should have it and provide education. Sometimes when people are misinformed, all they need is to have the right information provided for them that would make them change their mindset and understand it's for their own good to have the vaccination.
All right. Now, Dr. Kanem, here back in Nigeria, there are considerations where how do we get this vaccine to people and how do we get people vaccinated? It's still a question where government and those who are in charge of policy are trying to answer right now. But the point there is, whether people need the vaccine or not need the vaccine is not even the question right now, because COVID-19 has to be taken away from amongst the people. But when it comes to how to engage the people and then get them to come on board and agree to be vaccinated, how challenging do you think that is going to be at this time?
It's going to be a real challenge, based on the happenings in the past let's say about 11 months that we've been battling COVID-19. You see, there is what we call public trust, and public trust is the bedrock of public health enlightenment, like my colleague has said. Nigerians, as far as COVID-19 is concerned, Nigerians are increasingly believing that COVID-19 is just a venture because there's been a decay in public trust that cannot be overruled. Now, for us to be able to restore their confidence, we need to come all out. And like I used to say, there is need for us. I was going through what NCDC is doing, brilliant job. A lot of engagement is going on through the Orange Network. We need to replicate more of that in our communities. We need to engage our traditional leaders. We need to engage social media influencers. And that is one aspect that sometimes we overlook. But you see, the world has become a global village now. A lot of people in Nigeria believe what goes on in the social media. You could see what happened during the NSAS, but you could see that there is a coordination in the social media. So we need to bring these social media influencers together and tell them that, please, we need to work together. Because if everyone is not safe, nobody's safe. So let us see how we can engage Nigerians, talk to them, and get their buy-in so that they can accept to be vaccinated. Like my colleague said, you can't force anybody to be vaccinated. If you bring in the vaccine and people are not ready to take the vaccine, nothing can happen. You can't force anyone. So this is the time for us to begin that aggressive campaign, aggressive enlightenment, using every media channel in our disposal.
Okay. All right. Adaku, let me come to you now. The point there is, we hear parts of the UK is on lockdown. I wonder how people are coping with these realities right now, especially talking about the new variant there. Share with us.
Well, at the moment, all non-essential services are closed, like businesses that don't deal with food items, things that are not essential, they're all closed right now. Restaurants are closed and the school is closed as well. But healthcare services is still going on. When people go outdoors, they just have to wear their masks. If they go to do their shopping, and people still have to maintain social distancing, and we use our hand sanitizers, and we have to maintain respiratory hygiene as well. So it's affecting people in the sense that people feel a little bit lonely and tired about the whole thing, because we've had so many lockdowns last year, but we just have to put this lockdown in place so that we can try and reduce the rates of infection going on right now, because we've had more COVID-19 patients after the Christmas period. So the numbers are going high. So that is why the government has decided to put in this lockdown in place. But the vaccination program is ongoing across all the local centers. We have local vaccination centers where people are going to have their vaccination done. They just have to go through their medical centers, and we just have to review them, screen each patient to make sure that they are suitable to have the vaccine. And the vaccination is ongoing. Nothing is affecting the vaccination program, but our everyday life is being affected because people are working from home, and people have to always mask up when they are doing their shopping. So it is compulsory right now to wear your mask when you're in a public place.
Okay, you said something, screening patients to be sure they are suitable to take the vaccine.
Yeah.
Can you break that down for us? Who is suitable and who is not suitable to take the vaccine?
Okay, well, at the moment, I can't give you the full details right now, but the manufacturers of the vaccine, first of all, we had the Pfizer vaccine, and now we've got the AstraZeneca vaccine. The vaccine is a medicinal product. So all medicinal products, they have their contraindications, they have their side effects, they have like some patients take some medicines that thin their blood, some patients that are taking anticoagulants. We have to be careful because they can bleed through the injection sites. Also, some patients that have certain allergies. So we need to look at their allergy history. They're allergic to some antibiotics, they're allergic to some substances that might be used in producing those vaccines. So each patient is screened. I've had some consultations with different patients because we just have to check their allergy history to ensure it's not going to, that the vaccine is going to be suitable for them. And also, like I said, patients taking some anticoagulants, we have to check and ensure that the injection site is not going to bleed for a long time. Then we also have to put some emergency things in place for anaphylactic reactions. So some patients that go through anaphylactic reactions, we need to ensure that we have the adrenaline. So there's ongoing training for staff that are engaged in providing the vaccination program. And it's like a multidisciplinary approach. We have the doctors, the pharmacists, the nurses, healthcare assistants, we have volunteers as well. So everyone is working together to provide the service. And we're following the guideline given by the manufacturers of the products and the National Health Service as well.
Okay, well, it's really interesting to know. Now, Dr. Ekanem, back in here, there are concerns that, like the Pfizer vaccine, the requirement is for it to be preserved at a certain temperature, which should be not less than about 60 to 80 degrees. Bringing it back in here with our, at the tropical part of Africa, the temperatures here are generally on the high side, but the infrastructure to maintain the vaccine at minus 60 to minus 80 degrees, I wonder if we have what it takes.
Well, like you said, it's a challenge for us as Nigerians, Getting the vaccine is one thing, but preserving it is a very, very challenging thing. As I speak to you in Nigeria, we have only 1 or 2 centers in this country that can preserve, that have refrigerators at that temperature. What I feel that Nigerian government should do is, we have to choose between the Pfizer vaccine, which requires minus 70 degrees Celsius, or the AstraZeneca vaccine that can be stored at 2 to 8 degrees Celsius. For me, I feel that Nigeria should go for the AstraZeneca vaccine because that is the one that we have the facility currently to preserve and administer at the right condition. So depending on whichever one we go, we need to make sure that preparations are on ground to ensure that Nigerians can receive the vaccine in an efficacious state rather than being jabbed an inactive vaccine.
All right. We have to leave it here now. We'll wait to see how things will go. Thank you so much, Dr. Nsiabase Ekanem, for your time on the program.
Thank you, sir.
We appreciate you.
Thank you.
And thank you very much, Adaku Efuribe, for joining us, and thanks for your insight as well.
Thank you. You're welcome.
Great.